Hello viewers, welcome to Learning Lane. Today we are going to see typhoid fever pathogenesis, signs, symptoms, causes, investigation, prevention and treatment, 0 o'clock to 0:30. Introduction and causes. Typhoid fever, also known as enteric fever, is a systemic infection caused by the bacterium Salmonella enterica serovar typhi. This bacterium is highly adapted to humans, and the infection is typically acquired through the fecal-oral route. This means consumption of food or water contaminated with the feces or urine of an infected person. Common sources include contaminated water supplies, raw fruits and vegetables irrigated with contaminated water, and food prepared by infected carriers who don't wash their hands properly. The bacteria are very resilient, and even a small number can cause infection. It's a significant public health concern, particularly in areas with poor sanitation. 0:30 to 1:30. Pathogenesis. Once ingested, Salmonella Typhi survives the acidic environment of the stomach and reaches the small intestine. It then penetrates the intestinal mucosa, invading the Peyer's patches, which are lymphoid tissues in the ileum. Inside, the bacteria are engulfed by macrophages, but instead of being destroyed, they multiply within these cells. They then spread to the mesenteric lymph nodes, the spleen, and the liver, causing reticuloendothelial system involvement. From there, they enter the bloodstream, leading to bacteremia. This bacteremia is what causes the systemic symptoms. The bacteria can also invade the gallbladder, leading to chronic carrier states where individuals shed the bacteria without showing symptoms, further spreading the disease. The bacteria releases endotoxins which contribute to the fever and other systemic effects. Complications can occur due to intestinal perforation and hemorrhage. 1:30 to 3 o'clock. Signs and symptoms. The classic presentation of typhoid fever involves a gradual onset of a high-grade fever, often reaching 103 to 104 degrees Fahrenheit, 39 to 40 degrees Celsius. This fever is often accompanied by headache, malaise, and loss of appetite. Abdominal pain and constipation or diarrhea are also common. A characteristic symptom is rose spots, which are faint, salmon-colored spots that appear on the chest and abdomen. Other signs include relative bradycardia, a slower than expected heart rate for the level of fever, splenomegaly, enlarged spleen, and hepatomegaly, enlarged liver. In severe cases, patients may experience delirium, confusion, and even coma. The severity of symptoms can vary depending on the individual's immune system and the amount of bacteria ingested. Untreated cases can last for several weeks and complications can be life-threatening. 3 o'clock to 4 o'clock. Investigation. Diagnosing typhoid fever requires a combination of clinical evaluation and laboratory tests. The gold standard for diagnosis is blood culture, which aims to isolate Salmonella Typhi from the patient's blood. Bone marrow cultures are even more sensitive, but they are more invasive. Stool cultures and urine cultures can also be used, especially later in the disease. The Widal test, which detects antibodies against Salmonella Typhi, is also used, but it has limitations due to its lower sensitivity and specificity. Complete blood count, CBC, may show leukopenia, low white blood cell count, or leukocytosis, high white blood cell count. PCR-based testing is becoming more common due to its speed and accuracy. Prompt diagnosis is crucial for effective treatment and to prevent the spread of infection. 4 o'clock to 5 o'clock. Treatment. Treatment for typhoid fever primarily involves antibiotics. Fluoroquinolones like ciprofloxacin or ceftriaxone are commonly used. However, antibiotic resistance is a growing concern, so susceptibility testing is essential. Azithromycin is an alternative, especially in areas with fluoroquinolone resistance. Supportive care is also crucial, including maintaining hydration with oral or intravenous fluids, managing fever with antipyretics, and ensuring adequate nutrition. In severe cases, corticosteroids may be used to reduce inflammation. Monitoring for complications like intestinal perforation and hemorrhage is essential. Prompt treatment reduces the duration of illness and the risk of complications. 5 o'clock to 6 o'clock. Prevention. Prevention of typhoid fever relies on improving sanitation and hygiene, as well as vaccination. Ensuring access to clean drinking water and proper sewage disposal is crucial. Food safety practices such as thorough hand washing and cooking food to safe temperatures are essential. 2 types of typhoid vaccines are available: a live attenuated oral vaccine and an inactivated injectable vaccine. These vaccines are recommended for travelers to endemic areas and for individuals at high risk of exposure. Public health education about the importance of hygiene and sanitation is also vital. Early diagnosis and treatment of infected individuals help prevent further spread of the disease. Controlling carrier states by treating those who carry the bacteria is also very important. Global efforts to improve sanitation and access to clean water are essential for long-term prevention. Subscribe, share for more videos. Thank you for watching.